When children have severe pneumonia, even if the doctor is there and has the antibiotics and treats the child but doesn't have oxygen, half of those children that could have been saved will still die.
Every year, 700,000 children under the age of 5 die of pneumonia worldwide, including 6,000 in Kenya. One of the causes is the lack of access to medical oxygen for people living in rural areas.
Le groupe Air Liquide est un acteur majeur de la santé et un expert de l'oxygène médical et de sa mise en œuvre. Donc naturellement, dans son plan stratégique, le groupe a vraiment exprimé sa volonté forte de déployer l'accès à l'oxygène dans les pays à faible et moyen revenu.
In Nairobi, Access Oxygen is currently supporting CPHD and its subsidiary, Ewatele, an oxygen production and distribution company.
The solution that we have at Ewatele was primarily designed for higher level hospitals, but we didn't really do well in terms of bringing oxygen to the primary care facilities.
Thanks to Access Oxygen, Ewatele was able to distribute its offer throughout the country, in particular 400 kilometers north of Nairobi, in the suburb of Bungoma.
When they came, they brought us a whole package of what's supposed to be given for oxygen. They gave us the oxygen cylinder, the oxygen concentrator, they gave us the pulse oximeter, they gave us the regulator for the oxygen, and so many other benefits that we get from them.
In addition to the equipment needed to oxygenate patients, Access Oxygen also offers a training program for healthcare professionals and a maintenance service. Joyce coordinates the proper functioning of these operations on the various dispensaries she takes care of.
My daily activity is making sure that all my clients are always comfortable and having oxygen at all time. And I always keep asking if they have oxygen cylinders that they are empty and they need a refill every day.
They came and taught us how to take care of that concentrator that can equally give out pure oxygen at a rate of 95%.
Joyce also provides regular reporting to the Access Oxygen team to measure the daily impact of the program in the region.
We have seen reduced mortality rates. Patients have recovered from serious respiratory infections by using oxygen as a drug. Also, we have reduced the cost of refilling for existing customers by using the concentrator.
Access Oxygène apporte vraiment un soutien opérationnel pour accompagner les partenaires. Nous veillons également à ce que les règles de sécurité et de qualité soient bien respectées sur le terrain et au quotidien et qu'ils transmettent vraiment ces valeurs auprès de leurs clients.
And because the cost of oxygen equipment is a key issue, Access Oxygen also helps local partners find international donors.
And the reason why that we funded Access Oxygen in the first place is really that the work that Access Oxygen had done in Senegal was really pioneering within the oxygen as a service space. The Access Oxygen pilot in Kenya is innovative because of its specific contextual constraints. The pilot itself is in a peri-urban environment. It's one of our only pilots within the portfolio within that context. We're learning a lot about whether you invest in training and maintenance can actually lower the cost of oxygen delivery within quite a competitive oxygen supply market.
According to Dr. Olayo, the success of the program is due to the strong partnerships forged by Access Oxygen between financial organizations and local health operators. Ensuring that there's someone taking care of the solution at the local level and that the users have a way of appreciating and providing feedback. That package is rare and really essential for sustainability. From what we are hearing right now, we are quite happy to note that many more children are being saved at these health facilities. In 2022, Access Oxygen facilitated access to medical oxygen for 1.8 million people in Africa. New projects are in development, and Access Oxygen is looking for future local operators. They could benefit from the support of Access Oxygen to provide an oxygen therapy service and find financial partners to support them in setting up their projects.